Welcome back. So how do you know if you are at risk for Barrett's esophagus? Joining us now to talk more about this is Dr. Sohail. How are you?
I'm good, thank you.
Great
Glad
to have
be
you
here.
this morning.
Thank you.
Okay, so can you tell us about Barrett's esophagus? What is this?
So Barrett's esophagus is actually a disease of the esophagus that is seen in patients who have long-standing history of acid reflux. It is a precancerous condition, and it happens when the lining of the esophagus changes, and it can lead to cancer down the road.
And so is this pretty common in today's society?
It is common, acid reflux is very common,
Right.
okay? But if it's not controlled or treated appropriately, it can lead into Barrett's esophagus, which can ultimately cause the cancer of the food pipe, which is the esophagus.
Okay, and so, I mean, I've had,
Most of
acid
us.
reflux before,
Yes.
so should I be worried?
Well, if somebody who has this for a long period of time,
Okay.
then of course this needs to be checked by a gastroenterologist.
Right.
There are some risk factors. We call them as non-modifiable and modifiable risk factors, like age, being a Caucasian or male. Some modifiable risk factors as having control on the acid reflux, hiatal hernia, or controlling the weight.
Right.
Losing weight will help that.
Right, and if it's more common than not, obviously go see the doctor just to get
Exactly,
checked out to make
exactly.
sure
Yeah.
you're safe. Okay, so tell us, what are the benefits of getting this cured? I mean, a lot of people, have this and don't realize that they have it.
Exactly.
So also, what are some signs?
So the signs is like you will have any trouble swallowing. The patient may be having vomiting blood, abdominal pain, or
Okay.
losing weight. So these are the red flag signs that it needs to be checked. But if somebody has chronic GERD, which is called acid reflux, and it's not getting controlled on medications like acid suppressant medications, it needs to be checked by a gastroenterologist.
And tell us again about the treatment process at ETMC.
So ETMC is offering wide range of treatment modalities for these patients. Of course, we treat with medications. There are, let's say if a patient has Barrett's esophagus with some sort of abnormal cells, we use a technique called radiofrequency ablation, in which we use a catheter or a balloon to go and ablate and burn this Barrett. So
Is that painful at all?
No, the patient does not feel anything. It just reverses back the lining back into the normal. And in patients who have hiatal hernia, which is a risk factor for acid reflux, ETMC is now offering a new procedure which is called incisionless fundoplication, meaning incisionless repair of the hiatal hernia. So ETMC is going to be offering this service very soon.
Okay, and say that you do find out that you are diagnosed with Barrett's esophagus. Is it curable?
It is, depending on what is the degree of the abnormal cells within the Barrett's esophagus. If there are no abnormal cells, we have a surveillance program that the patient gets endoscopy every 3 years or something like that. But if it is with abnormal cells, then the radiofrequency ablation is pretty much curative.
Great. And if people have questions about this, can they contact you directly?
They can contact us through our office, ETMC Gastroenterology, and we'll be more than happy to provide them with more information.
Great. Thank you so much for all the information. Learned a lot.